Post-operative instructions, wisdom teeth removal. Post-operative care following the removal of wisdom teeth is very important. Unnecessary pain and the complications of infection and swelling can be minimized if the instructions are followed carefully. Bleeding. Some bleeding or redness in the saliva is normal for 24 hours. Excessive bleeding can be controlled by biting on a gauze pad placed directly on the bleeding wound for 30 minutes. Change the gauze pad every 30 minutes as needed. Remove the gauze when it is no longer needed. Do not rinse vigorously, suck through a straw, or spit excessively in the first 24 hours. If excessive bleeding continues, please call for further instructions. Swelling. Swelling is a normal occurrence after surgery. To minimize swelling, apply an ice pack on the cheek in the area of surgery. Apply the ice continuously as much as possible for the first 24 to 36 hours. Swelling generally reaches a peak in 24 to 36 hours and then subsides over the next 3 to 5 days. If swelling begins to increase after the third post-operative day, please contact your doctor immediately. Diet. Drink plenty of fluids. Avoid hot liquids or food. Soft food and liquids should be consumed on the day of surgery. Keep all solid food away from the surgical sites. Medications. You should begin taking the prescribed or over-the-counter pain medication prior to the local anesthetic wearing off. If you can take ibuprofen, Advil, or Motrin, take 600 to 800 milligrams every 6 to 8 hours for the first 2 days. If you cannot take ibuprofen, take 650 milligrams of acetaminophen, Tylenol, every 6 hours for the first 2 days. If you are still having pain after using these medications, you should take the prescribed medication as directed. Please note that if the prescription has acetaminophen in it, it cannot be combined with Tylenol. Taper off the pain medicine as you are able. Do not take any of these medications if you are allergic or if you have been instructed by your doctor not to take it. This may include patients with liver or kidney disease. Dry socket. A dry socket is when the blood clot dissolves or gets dislodged prematurely from the tooth socket, leaving exposed bone in the socket. Symptoms include pain at the surgical site and even pain to the ear, and may occur 3 to 4 days following surgery. Ibuprofen tends to be more effective than the narcotic pain medication. Call the office if the discomfort is severe. Medicated packing can be placed to relieve the discomfort. If antibiotics are prescribed, be sure to take them as directed to help prevent infection. Oral hygiene. Good oral hygiene is essential to good healing. Warm saltwater rinses should be performed after meals. This should be performed until no food collects in the healing wound. Do not brush the 2 adjacent teeth on either side of the extraction site for the first several days. Return to normal hygiene as you are able. You may floss normally starting the day of surgery, if comfortable. 5 days after surgery, the monoject syringe provided should be used to direct water into the lower extraction sockets to remove any food and debris following meals. Discoloration. In some cases, discoloration of the skin follows swelling. The development of black, blue, green, or yellow discoloration is due to blood spreading beneath the tissues. This is a normal post-operative occurrence, which may occur 2 to 3 days post-operatively. Moist heat applied to the area may speed up the removal of the discoloration. Nausea, vomiting. 3 main causes for nausea or vomiting are sensitivity to the medication, taking the medication on an empty stomach, and swallowing blood. In the event of nausea and/or vomiting following surgery, please take the anti-nausea medication as prescribed. Avoid anything else by mouth for at least an hour after the nausea has passed, including the prescribed pain medication. You may then sip on tea or flat ginger ale over a 15-minute period. Activity. Keep physical activities to a minimum immediately following surgery. If you are exercising, throbbing or bleeding may occur. If this occurs, you should discontinue exercising. Keep in mind that you are probably not taking normal nourishment. This may weaken you and further limit your ability to exercise. Questions? If you have any additional questions, please call our office or browse our website. Our staff is happy to help you in any way that we can to make your post-operative recovery successful. Thank you.